But ASCO, we're also going to get update on various important trials in small cell lung cancer. There are three major trials that we're very much looking forward to hearing about. First of all is ECOG Academics randomized phase 3 study in the first line extensive stage small cell lung cancer. Here, patients with platinum etoposide chemotherapy were randomized to receive nivolumab alongside the chemotherapy, followed by nivolumab maintenance or not. And the abstract reports that this study was positive for overall survival, therefore potentially adding nivolumab as an alternative to the positive studies that we have so far with durvalumab, Caspian, and atezolizumab, IMpower 131. So let's see the data on that in more detail. But also the Caspian study, you may remember, allowed patients to have chemotherapy for extensive small cell lung cancer and were randomized to either durvalumab plus chemo, for which we already know there's a survival advantage, or durvalumab plus tremelimumab. Unfortunately, the abstract reports that this study was negative for the durva-tremi arm, but it seems, according to the abstract, only marginally negative. So I'm very much looking forward to the data to see, how much did it miss the target by? Was it a power issue? Was it a sort of crossover issue? Was there two different populations in the survival curves? Let's see that data in more detail. And similarly, we have another trial in small cell that we've all been waiting for, Keynote 604. This is a trial of extensive stage small cell lung cancer in which patients are randomized to receive chemo plus pembro or just chemo alone. And again, the abstract reports that whilst there was a PFS benefit and an OS benefit, the overall survival benefit was not statistically significant. The hazard ratios, confidence intervals just missed out from significance. So I think we need to look at that in more detail and to find out, where are we with the activity of that drug. But there's a lot going on in small cell as well. So overall, it's going to be a great ASCO 2020.